Welcome students. This is for diploma in pharmacy students. Actually your syllabus have been completed. I want to give some revision classes for you, and you have to listen to my class of scope of pharmacognosy, definition, history, adulteration, all these things. Already I have uploaded. I will upload again or share my link to you in the group. It is necessary for you to listen. Today I have taken a small topic for D-Pharm student, that's about biological source, chemical constituents and therapeutic efficacy of the following category of crude drugs, the chapter number 4 actually, the unit, in which I have taken a small part. The first part, almost all of them they have given by pharmacological classification. So in that first one they have given laxatives. In that only 4 drugs they have specified for diploma in pharmacy students: aloe, castor oil, Ispaghula or Ispaghula and Senna. There are many natural herbal drugs are there, but they have given only 4 for the diploma in pharmacy students. So according to that, they have given you have to study about the source, chemical constituents and the therapeutic efficacy or the pharmacological action or the use, application, medicinal use of the drug is necessary for the students to study and to know and to clearly write in the examination. So first we should know about what is laxative, very important, because you are going to counsel the patient and as well as dispense the drug. So you should know some pharmacological terms and different types of laxatives, and what is the laxative which we are studying as a natural sources. This is all important for the student to clarify. So laxatives, purgatives are aperients. Well, aperients means evacuating the bowel completely. So you can see there is words laxative, purgative, cathartic. So they all are same used to evacuate the bowel, but there is different in their action. The severity of the action makes them the name laxative, purgative and cathartic. So laxative means are substances that loosen stools and increase bowel movement. They are used to treat and prevent constipation. You might remember when I asked in the class, immediately students were telling that laxative means it's used for constipation. 100% true. But there are many types of laxatives. In that we have to clarify these 5 types, especially bulk forming laxative. These are not digested but absorbed liquid in the intestine and swells to form a soft bulky stool and it will be expelled. Example, Ispaghula, the drug which is given, you are going to study in our syllabus. Ispaghula is a bulk forming laxative. Emollient laxatives are there, stool softeners. We are not studying any example of natural source. Helps the liquid mix into your poop, that is stool, to prevent dry hard masses from forming. So it will prevent the hard massing and constipation will be prevented and it can be expelled. That is emollient laxative. Example which is available in the market and in the dispensary, when you dispense Dulcolax, everybody knows Dulcolax. It's a stool softener the chemical compound contained or the drug which is present as an active principle in the tablet or in the various other formulation in powder form, or even it is also formed as in suppositories. Docusate sodium. Docusate sodium is the male constituent which makes as an emollient laxative. What it will do, it softens the stool by help a liquid mix into the your poop or a stool to prevent dry, and the hard mass formation will be prevented. So number 4, lubricant laxative. Lubricant, it lubricates the intestine and facilitate passage of stool by decreasing water absorption from the intestine. Example, magnesium hydroxide, mineral oil. So we are going to study about castor oil. From the natural, castor oil is one example which we are studying according to the syllabus for diploma student. Castor oil, they are mineral oil which is used as a lubricant laxative. The next 4th one is hyperosmotic laxative. Hyperosmotic laxative. This also we are not having any natural sources to give you in the syllabus, so we didn't take that one as an example. But we should know that glycerin, sodium phosphates draw the water into the bowel from the surrounding body tissues. So glycerin, sodium phosphates mixtures, enema, these all mixtures, for example, hyperosmotic laxative. They also used for evacuating the bowel. So number 5 is stimulant laxative. You see, stimulant laxative, we have 2 examples we are going to study according to the syllabus, aloe and senna. So stimulant laxatives encourage bowel movement by acting on the intestinal wall. Example, aloe and senna. So we are going to see only 4 drugs according to our syllabus for diploma in pharmacy students. Aloe, castor oil, Ispaghula Senna. As the syllabus says, botanical source or biological source, chemical constituents, and its therapeutic efficacy, or you can say pharmacological use or medicinal use, we should know about them. Aloes, everybody knows, in Malayalam it is called Kattarvazha. It's even an ornamental plant in our home, and we are using for cosmetic purpose more. The females know this very well. It's an unorganized drug, exudate, which is taken from the leaf. And you can see common name aloe vera, medicinal aloe, burnt plant. In Hindi you can say ghee kumari. Marathi it was called as korpan. In Tamil it is kattari. In Malayalam just now we have seen this kattarvazha. And you can say cheru kattara. In Nepal, you can say it is called as Kalabanda. And Assami, it is called as Chal Kanwari. It's a very interesting plant. Even they have studied it as anti-cancer effect also. Now they have research is going on. Synonym, aloe. In Gujarati, it is called actually Grit Kumari and aloe. And botanical source, aloe is a dried juice in unorganized drug. It is actually a dried juice collected by insertion from the base of the leaf of various species of aloe. Internationally, there are 4 types of aloes are there, the student should know that aloe borbidans, or you can say curaco aloe. In borbidans, it is called curaco aloe or borbidans aloe also one. And Cape aloe is from Africa, South Africa. And Socatrin aloe is from Arab. And Zanzibar aloe is also from East Africa. So you can see there is 4 varieties are very, very strong value in the world market. So that's why we have taken. In our India also we have aloe, lots of productions. These 4 are very important to know. There is aloe borbidans. Miller is the scientist name. It is the main one, Curaco aloe in Barbados. It's cultivated. Aloe ferox. It's also Miller scientist who have identified, or you can say Cape aloe. It's in South Africa. Aloe peribaster is or it is called as Socotrin aloe. It is an Arab based aloe. And aloe africana, it is also aloe spicata backer. It is available in the East Africa, that is a Tanzanian area, that is Zanzibar aloe, the islands which is present there. All these species belongs to the family Liliaceae. So we should remember about the 4 types of aloe. I hope this is name only I am given, as a diploma students also should know that. That is Curaco aloe, or it is called Barbados aloe. Barbida is actually Barbadosis, or you can say it is present in Barbadensis, you can say aloe, or you can say Curaco aloe. Cape aloe, South African aloe. Socatrin aloe, it is Arabian country aloe in Socatrin. And Zanzibar aloe is East Africa, and it is Tanzania species, which is Zanzibar aloe. So these 4 aloe, students, this is Curaco or Barbados aloe. Barbados is present near to the United States of America, islands. We know that West Indies. So from there it is. And this is Cape, South Africa. Is a city which is South Africa, is one of the country. This is the plant which is called Cape aloe. In South Africa, a shallow circular pit in drug and covered with goat skin they used to give, or a canvas. Cut leaves are arranged radially. This is about the Socotra, Arabic Socotra it is. Also called as Socotra, located between the Guadalfi Channel and the Arabian Sea. It is the largest, you can say, largest of the 4 islands in the Socotra archipelago. So it is an Arabian Sea. The different type of aloe. The plant which is aloe, it looks like a tree, you can see that. Aloe, the species. So this is the 3rd one which we are discussing. Socatrin aloe will be having even that size, and this also the picture which I am showing. Usually it has the leaves are bent. Next one is, you can see Zanzibar, the place, or you can say Zanzibar aloe. It's an island which is Tanzanian archipelago of the coastal of East Africa. On its main island, Unguja, familiarly called as Zanzibar, in Stone Town. It's a beautiful picture I have taken, the Stone Town, a historic trade center with the Swahili and Islamic influences. So Zanzibar aloe is the 4th one. It's an ornament plant, even we are having in our home also. It's an aloe which is prepared similar to the that is Arabian that is Socotin aloe. It is packed in a skin of carnivorous animals. Usually this aloe is also known as monkey skin aloe. Socotin and Zanzibar aloe are opaque, while see in morphology. Chemical constituents of aloe: aloe emodin occurs in free state and as a glycoside in the various species of aloe. You can see aloe emodin free state, and when it is combined it is in aloin, that is a glycoside. A student can at least remember this A-glycan and glycan. Glycan part is glucose molecule which is attached in an C-glycosides. Very clearly you can see the O molecule of the double bond O of the emodin is removed and you can have a linkage as shown in the picture. Aloin, androquin glycoside. The androquinone, you can see the double bond, androquinone glycoside aloin as shown in the picture, as shown in the structure which is clearly, or barbaloin it can be called. The aloes also contain isobarbaloin, beta barbaloin, beta linkage of glycoside, aloe emodin and resins. The principal resin present in the aloe is known as aloesin. The name is aloesin. Resin, aloesin, you can remember. Aloin is the glycoside. An androquin glycoside aloin you can remember. Understand? Can you follow? Very easy. Barbaloin, isobarbaloin. You should remember these names of the chemical constituent. Uses: the aloe most used as a purgative by exerting its action mainly on colon. Purgative means little higher version of the laxative. Strong action. Understand? Evacuating of the bowel. Aloes find its usefulness as an external aid to pain, inflammation, manifestation also. It consists an important ingredient in the compound tincture of benzoin. When you see compound tincture of benzoin, it's an important ingredient. And also even Flair's balsam, which is available in the market also, they used to add aloe as an important constituent in this formula for pain relieving. Aloe gel from the mucilaginous lactase of aloe vera is frequently employed in the treatment and cure of radiation burns to get immediate relief from itchings and pains. In cosmetology also they are using more this aloe vera gel. Aloe usually causes gripping. Normally when you are using for laxative purpose or a purgative purpose, it may causes gripping. Gripping means not completely evacuating. 2-3 times you have to go for toilets. You may have to feel that. To evacuate bowel frequently, this people may not feeling that not completely evacuated. So a morning evacuating bowel 2-3 times may be going. This gripping problem will be seen even if you are using this aloes as a medicinal drug for purgative purpose or laxative purpose. It may cause gripping. So therefore it is administered or it is formulated in such a way with and carminatives. Along with the carminatives. Carminatives means which expels the unwanted gas which is formed in our body by means of the acid secretions. So you can add aloe along with an carminative and it can be prescribed or it can be utilized for the purpose of laxative or for purgative purpose. Castor oil, the number 2 is castor oil, the drug which is you have to store. Synonym: oleum resini, resinous oil. This all it can be called as resinous oil. You know very well this plant, castor oil. Botanical source: it is a fixed oil which is obtained by cold expression by compression of the seed of the plant Resinus communis, family Euphorbiaceae. Location Brazil, Thailand, United States of America, Romania and India. In India, Andhra Pradesh, Gujarat, Chennai, West Bengal, Maharashtra and Karnataka. India ranks second in the world in production of castor oil. In India, Andhra Pradesh produces about 60% of the total Indian production. This is the seed. How beautiful cover with a design, the seed coat. You can see the picture. And this is the fruit of desiccant of the seed ready for collection. And this is the structure of the seed with the whole seed. And when it is cut, you can see the embryo, cotyledons, tegmen, testa and endosperm, and the design of the whole seed of the hilum and the seed coat. After the removal of the seed coat, you can see the kernel, the inside part for the oil preparation to squeeze and take direct compression after removal of the seed coat. So now we should know, according to the syllabus, what is the constituents present. When you see the seed, it consists of 75% kernel, the inside part, and 25% is the hull, the outer part. In kernel, the oil content varies from 36 to 60% up to the quality from where it is collected. Outer part, that is hull, consists of minerals, alkaloids, resin and a resin and a pigment. The castor oil seed or a castor seed contains even enzyme like invertase, lipase and maltase. It also contains a toxic substance like resin, R-I-C-I-N, resin, you can say not resin, resin. Toxic protein. This resin poisonous base responsible for poisonous nature of the seed. Castor oil, what are the main active constituent present in the castor oil is 80% of triglycerides, that's of resinolic acid C19H24 or not 24, 34O3, C19H34O3, responsible for the viscosity and the purgative action of the castor oil. So you should know that which is the constituent responsible for the viscosity and the purgative action or the laxative action. Triglycerides of resinolic acid. The castor oil also contains other triglycerides of isoresinolic acid, linoleic acid, stearic acid and isostearic acid. It contains heptanol, undecanoic acid and sebacic acid. It also contains hair growth vitamin. Castor oil having hair growth vitamin, vitamin E is also present there. Uses: castor oil has the mild purgative and apparent action as resinolic acid irritant and intestinal mucosa and enhance the motility of colon. Lubricant laxative. It is administered in food poisoning to evacuate the bowel. Products obtained from castor oil like undecanoic acid used as a fungicide. It is used in the manufacture of soaps and detergent. It is used in the preparation of varnishes, enamel, grease, polish and printing ink. Resinolic acid is an important constituent of spermicidal cream and jellies. Spermicidal contraceptives can be used. Spermicidal creams and jelly. Racemolic acid is an important so that the sperm will be expelled. Racemolic acid is used as an abortifacient. Even it is used as an abortifacient. For example, unprotected sex, getting a pregnancy, even it can be used as an abortifying agent. Racemolic acid. It is used as an emollient because it's having more viscous. Due to it is moisturizing property. It has moisturizing property. It can be used as an emollient also. It has a moisturizing property. Now the third one, Ispaghula or Ispaghula. Ispaghula consists of dried seeds of plumbago or plantago, not plumbago, plantago, 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 Plantago ovata. Forsicle is a scientist name, Plantago ovata, belonging to the family Plantaginaceae. This is the plant which we might have seen everywhere in near to the, when not all the places, in some area it will be grown in our place also. That is husk, the outer skin, that is also having the swelling property, which is used for expelling, and it is evacuating bowel. It can be used. It has in the absorbing capacity, and swelling capacity is also there to give the pressure for expelling the poo or expelling the stool from the colon. This is the plant, just a drawn plant. Blonde psyllium, P silent, psyllium. Blonde psyllium, it is also called a synonym, blonde psyllium. Plantago ovata is the low herbaceous annual plant native to Iran and India. Chemical constituents of Ispaghula. Ispaghula seeds contain about 10% of mucilage, which is present in the epidermis of testa. Mucilage contains of two complex polysaccharides, of which one is soluble in cold water and other in hot water. One is soluble in cold water and the other is in the hot water. Which one? Chemically, they are pentosan and aldobionic acid. Pentosan is soluble in cold water. Aldobionic acid is soluble in hot water. Pentosan on hydrolysis yields xylose and arabinose. Aldobionic acid yields glucuronic acid or glucotornic acid and ramenose. Protein and fixed oil are present in the endosperm and embryo of Ispaghula seed. Ispaghula seeds are used. What is the use? It is used as an extensive demulcent and a bulk laxative. It is a bulk laxative. In chronic constipation, it is used as a bulk laxative. The laxative activity of Ispaghula mucilage is purely mechanical. It is also useful in dysentery in some cases. How? It is used for laxative to evacuate bowel, and even it can be used for dysentery because it has a swelling property so that it controls even in the dysenteries of mucous membrane which can be expelled, eradicated from the intestine. So dysentery can also it's useful in chronic diarrhea, in case of duodenal ulcer and piles. It works effectively as a smoothing agent or a soothing agent. Ispaghula husk also, that is the membranous outer coating, the picture which I have shown, is also used in a similar purpose. Now we are coming to Senna. Senna is an example of androgen glycoside as aloe. Synonyms: Senna leaf, Tirunelveli Senna, Alexander Senna, Cassia Senna, Indian Senna. But biological source, it consists of dried leaves of Cassia, or you can say Cassia angustifolia, or Cassia Senna wall, that is Tirunelveli Senna, and Cassia acutifolia, Delhi. This is African, that is Alexandrian Senna, little bigger one, Alexandrian Senna. Family Leguminaceae. Cassia acutifolia, this is the picture, Cassia acutifolia, Alexandrian Senna. This is Cassia angustifolia, Tirunelveli Senna. The leaf and flower pictures, which we might have seen, that Cassia angustifolia, very common in our places. Cassia angustifolia, Indian Senna, is cultivated in Tirunelveli, Madurai. Geographical source, just because it's very common plant in our place. Tamil Nadu, Ramanathapuram district, Andhra Pradesh, Gujarat and Rajasthan. Cassia acutifolia, it is an Alexandrian Senna, is indigenous to tropical Africa and cultivated in Sudan, Middle East and Upper Nile territory. Senna is used as a cathartic to remove. It is a stimulant, and in ancient times it also included in Unani system of medicine. As a cathartic it has been used. Near about 26 species are being known which contain anthracene derivatives in free form and a glycoside state of anthraquinone glycosides. Among them, Cassia angustifolia and Cassia acutifolia are in official monograph of pharmacopoeias. Chemical constituents: Senna contains sennoside A and B, 22.5% based on the A-glycan sennoside A and B. Sennoside C and B, which are glycoside of heteroanthrones of aloe, emodin and ruin, are present. Other include the palmidin A, ruin emodin, that is anthrone, and aloe emodin glycosides, anthraquinone glycosides. Senna also contains free cryophenol, emodin and other glycosides and free aloe emodin. Ruin, their monoanthraquinones, dianthones and their glycosides are also present. Mucilage is present in the epidermis of the leaf and gives red color with ruthenium red. This is the chemical structure which we have shown even for aloe emodin, aloein, which I shown. You can see there is the anthraquinone glycosides which can be connected in the O glycoside of sugar molecule. There it is C linkage. So you can see there are sennoside A, sennoside B, sennoside C, sennoside D. All of them are geometrical isomers. Sennoside A is transform. Sennoside B is mesoform of acid. Sennoside A is transform of acid. And sennoside C is transform of alcohol, CH2OH, the substituent. And sennoside D is meso form of CH2OH. So they are having isomeric form. Uses of senna. Senna leaves are used as a laxative, stimulant laxative. It causes irritation of large intestine and has some gripping effect. Thus they are prescribed along with carbonatives, as you did for aloes. It has to be along with a carbonatives because it will cause gripping. As I told us, it feels that it's not completely evacuating at a time. It feels slowly, again and again, the 2-3 times the gastric formation may be there. That can be expelled by using carbonatives. Senna is stimulant, cathartic, and exerts its action by increasing the tone of smooth muscles in large intestine. Marketed product, it is one of the ingredients of the preparation known as Constivac, Softvac, Lupin Laboratory, and Isovac powders, Kultab tablets from Vasu Healthcare. This is about the Kultab. This is about Isovac. And this is 2 pictures which I have shown to you, which is in this slide, is the difference in the African senna or Alexandrian senna leaves, little larger. And this is about Tirunelveli senna, which is little shown in our place, and its spores also having laxative activity. It also contains some constituents of anthraquin glycosides. So this is that is Alexandrian senna is Cassia acutifolia. Tirunelveli senna is Cassia angustifolia. So this is a small lecture which I have given for only for laxative according to the syllabus. Kindly write a assignment and submit to my office in coming Monday. That means you have time. It's a very short assignment. Tomorrow I expect you to write the assignment and bring to my office. Thank you. Thank you for listening.